Radiotherapy had never been a part of undergraduate portion or syllabus for all the MBBS students. They are totally clueless when they go for a counseling, postgraduate counseling with the rank. They are absolutely clueless what is so. We get radiation more, I believe so, in radiology than in radiotherapy. With an order and circular that this is no more an MD radiotherapy, it is an MD radiation oncology. The degree per se becomes a radiation oncology, and oncologists are called with the name of designation as radiation oncologist, not a radiotherapist. I always proudly say, name any part of the atom, any part of the atom, we are using any particle in the atom, we are using in radiation. The radiology and radiation oncology, both we study the same physics. The fundamental is the same. The fundamental of radiation creation or radiation production is same. So what radiology, MD radiology is going to learn, we are going to learn. So nothing different. They also study the same physics. The thing is, I will say they are dealing with machines alone. The patient never belongs to the radiology, but to us, we learn physics, we treat the patient per se belongs to us. We are more of a clinician, we are more of a physician who handles and treats the patient, and the patient actually belongs to you. You treat them, you cure them, and you keep them in follow. But investing on the machine of radiation oncology is quite costly. Not everybody are affordable to go and invest a machine of 10 to 20 crore machines and start a practice.
That's not quite costly, it's very costly. Can you enlighten us regarding that scope?
Having your own cases, getting established down the line for 5 years, you have to get yourself established. Then you can draw patients towards yourself. Take the patient and then you can treat them. Get paid only for the case basis. So that is what kind of private practice you can do.
So what about the opportunities abroad as per your knowledge? What is the pay scale? It is on par with radiology or any other post graduation, or it is higher than that? Or can you comment on that? Hello, ma'am. Thank you for joining us. So I think the upcoming conversation will be very useful to the doctors who are planning to take radiotherapy. What is the field and how? What is the learning here? And how the life is going to be and what are the scopes in this field, etc. So, ma'am, can you? Where did you have your undergraduation, ma'am? And in which year you completed?
Hi Vinod, and thank you for asking me and to give an interview like this. It's very good thought out which you have given, helping the youngsters in choosing the field which they want to enter. And it's my pleasure to be here. And to start with, I joined radiation oncology in 2011 and I completed in 2014. Around that time, I did that. But
yes. Which college you studied?
I did from PJ Chandigarh, postgraduate.
Okay. So, and what are the colleges? I think the course is very limited in India, ma'am. Like how many colleges are having in India?
I don't know the exact number, but approximately around 50 to 70 approximately must be having radiotherapy.
Okay, around 70 seats are there all over India, ma'am. Okay. Ma'am, in the during the post graduation, so how the learning will be like? What you will be doing first year, what will be doing second year, what you will be doing third year now?
Okay. Before going into that, actually, which I want to mention here is radiotherapy had never been a part of undergraduate portion or syllabus for all the MBBS students. They are totally clueless when they go for a counseling, postgraduate counseling with the rank. Uh, they are absolutely clueless what is radiotherapy, because even radiology we have a
Yeah.
part of curriculum, so we know what is radiology, but not about radiotherapy. And basically, oncology per se, it's a small part of surgery where we study about carcinoma, breast, and colon. Other than that, therapeutically, other than surgery, neither the chemotherapy part nor the radiation part, people are aware of it. So, basically, regarding the subject radiotherapy, it is the same radiation we use both radiology and radiation therapy, which many may not. This, the difference between the two is, in radiology they use kilo voltage radiation, which is a low voltage radiation. In radiotherapy they use the same radiation, but it is a bit high voltage, called mega voltage radiation. That is the difference. So for diagnostic purpose, the low voltage is enough. By therapeutically, we need to destroy the cell. We need a high voltage radiation, but both are
Okay.
radiation basically. And doesn't mean that high voltage means more absorption. No, it is
Mhm.
the vice versa. Actually, mega voltage radiation, though absorption is more, the
Mhm.
shielding we do is immense, that the radiation leakage will be very minimal. Whereas
Mhm.
in radiology, day in, day out, we take x-rays, we can we
Yes.
expose the patients and ourselves as a professional to more investigative procedures. So we get radiation more, I believe so, in radiology than in radiotherapy. So in first year, second year and third year, it is all about, first year deals with what is the basics of radiation, how radiation is produced, how it is executed in radiology and radiotherapy. This is what you learn in first year. As you go on to the second year and third year in radiotherapy, you learn about the therapeutics, more about oncology, pure oncology. What are the malignancies where there is a role of radiotherapy, and what are the malignancies, how do you treat them, how the solid malignancies respond, and what are the doses of radiotherapy. This is how you deal. Basically, it is pure oncology. It's a field of oncology where you will learn in and out of oncology, and that is how you go into.
Okay. Uh, Ma'am, regarding that, you said regarding that learning aspect, while learning radiotherapy, how the subject will be like? Is it like we are studying about pathology and cancers? Or it also about the physics and the engineering behind the radiotherapy? That also will be teach or will be taught.
Yes. Uh, uh, Physics, we will start in the first year. First year is all about mainly the physics. So how,
Mhm.
I always proudly say, name any part of the atom,
Mhm.
any part of the atom we are using, any particle in the atom we are using in radiation. So it's basically the atom. So the physics is more in depth. And
Yeah, I thought so.
once you are lover of physics and exploring the universe, how the an atom model and the earth is revolving around the sun, all these things, you are loving
I
physics.
think
You
not
always,
everyone will be in that.
not
Okay.
everyone loves it, but you will start loving radiotherapy. You
Actually,
know,
there are.
yes,
It is wonderful, man, to
yes,
learn that.
like basically we are more towards biology in
Uh,
medicine.
yeah,
All
yeah, yeah. Definitely. See, my question is like that only, like because in medicine mostly we never see the physics aspect of only physiology. We used to study some maybe physics might come, but in here I thought it might have physics also. So I just asked about. And how was the exams? Is it like there will be exams regarding physics also? There will be there uh, during in first year, second year.
not so tough,
Um,
the radiology and radiation oncology both, we study the same physics. The
yeah.
fundamental is the same. The fundamental of radiation creation or radiation production is same. So what radiology, MD radiology is going to learn, we are going to learn. So nothing different. They also study the same physics. The thing is, I will say they are dealing with machines alone.
Mm.
The patient never belongs to the radiology, but to us, we learn physics, we treat the patient per se belongs to us. We are more of a clinician. You are more of a physician who handles and treats the patient, and the patient actually belongs to you. You treat them, you cure them, and you keep them in follow. Clinical side, rather than the radiology where they are
Yeah,
doing this job, they deal only with the computers, reporting,
yeah,
and
yeah.
doing.
And
So
one
this,
important question, yeah, one important question, ma'am, regarding the amount of exposure to radiation. There is a myth, or I don't know whether it's a myth or not, but is it like the radiotherapist? I mean, there is a increased exposure to radiation. Is it like that, or is it the same level compared to the radiology?
okay, Vinod, I would like to correct you here. Radiotherapist is the technician who works under the radiation oncology.
Very
So actually, the
yes,
terminology has been changed by the NMC per se. After the MCI became NMC, with an order and circular that this is no more an MD radiotherapy, it is an MD radiation oncology. The degree per se becomes a radiation oncology, and oncologists are called with the name of designation as radiation oncologist, not a radiotherapist. Because it's okay, Vinod, because many go by this name, and I want to
yeah,
stress that.
because actually no, we used to end with the IST with degree. So I thought it will be like that only. So then I, after you saying that, I decided, okay, I thought, okay, that may not be the right way. Okay, I
Okay.
understood, ma'am. I think we can add it.
Yes.
I will cut my question part and I will add
No,
your
no,
thing.
actually, you should telecast it because, like, yes, it's a common
Yes,
question which is so it goes in the medical fraternity like that. So I think everyone will get to know that. And that
yeah. Okay,
radiation,
let it be like that only, man. Another important aspect, I saw
and
something in
regarding
between.
the radiation exposure you asked,
Yeah, that.
in modern world, we are completely safe, which I can say, because there is a center called Atomic Energy Regulatory Board,
Mm-hmm.
AERB, which is functioning based in the Mumbai for the entire India. They are the radiation regulatory board. They
Mm-hmm.
have a strict guidelines laid
Mm-hmm.
down so strictly for the radiologist and radiation oncologist. How much should we get an exposure? What is the annual exposure limit? This is very hard and fast rule which is laid down, and there is absolutely no way we have getting any amount of radiation that actually causes harm to us. So one, you
Mm-hmm.
can be very sure of it regarding the radiation. You are not going to get exposed,
Mm-hmm.
or you are going to get exposed as minimal as a radiologist. One thing. So how we are safe? How can you be so sure we are safe? Because
Yeah.
the machine, per se will have a RCC concrete wall with a thickness of 6 feet. Imagine we are all a normal average human being is 5 to 6 feet high. That
Yeah.
amount of thickness of concrete wall is laid down all around the machine, and they
Mm-hmm.
have strict guidelines that no amount of radiation will be given through the door because the door will be like a maze. We play a maze game, no? Maze.
Yeah, ma'am.
Yes. And the maze game was this able to play how a cat will reach the
Mm-hmm.
mouse inside the maze. Like that kind of an arrangement is there. So hardly any radiation comes out. And absolutely, there is a board which regulates the amount of radiation. And every 3 monthly, we are sending our batches to them, and we get our radiation exposure dose, and it comes in 0.0000, like that amount of unmeasurable amount of doses only we get it.
Mm-hmm.
Me being in this field for 8 years, I hardly had any exposure. I had 2 children, and I was pregnant all through practicing in this particular after radiation oncology only. I had my 2 children, and even during pregnancy, we have a complete of protection from the radiation. So that's it.
That is actually that will be very helpful for many people, ma'am, because they also have had this. I mean, doubt whether how much I mean the amount of radiation exposure to I mean exposure they exposed while doing the post graduation. And let's come to the like how did you decide to take radio oncology? Whether um, you it was your decision or it just happened? How you selected, man?
It just happened, Vinod. Actually, now I'm giving an awareness video in your interview, but at that time I never had any awareness. I had a rank, and it's an average rank which I had when I went initially. I had this transfusion medicine because stem cell therapy was upcoming in postgraduate in PJM and Chandigarh. Transfusion medicine had an attractive point of stem cell therapy. So I went in, then I realized that they harvest only the stem cell, but we don't have that patient belonging. I'm not a clinician, I'm not a physician. So basically, I want to go into another field. So at that time, I reappeared for the second counseling. Then I had this radiation oncology. By the time I had a small interval of period where I had the time to go and inquire what is radiation oncology, what is the scope. They said the radiotherapy deals with oncology and you can be a physician like I was looking to. So I thought, why not I go with this field? So it is purely by choice, not I had no in-depth knowledge I had. But after entering, I realized, okay, we are an oncologist who deals with a proper or a separate field, a specialty field with a master degree. We don't need DM degree as a specialist per se, but also they assured me that I can do a DM medical oncology after MD radiation oncology. So one thing you have wide scope after becoming a radiation oncology. You can do a medical oncology DM. You can practice both radiation and medical, which is wide open and it is legally authorized. And
Mm-hmm.
in radiation oncology, we have what is called gamma knife and fiber knife, which is
Mm-hmm.
more equal to a surgical therapy. With radiation, sharp focused radiation, the radiation will act like a knife and it will cut along the tumor and it will deliver radiation to the position of a knife. So it is called gamma knife or cyber knife, which is again a
Mm-hmm.
radiation oncology machines, which I think very few of them even in the medical field knows.
Yeah. Okay. Can you enlighten us regarding that scope? Where did you apply? Then where? What are the options available for you to practice? Then how did you choose the currently what you are doing now?
Okay. Actually, options of working is there available both in the government and corporate. But I have to mention there is one flaw. One flaw means you cannot have an independent practice. You can have an independent practice, but investing on the machine of radiation oncology
Yeah.
is quite costly. Not everybody are affordable to go and invest a machine of 10 to 20 crore machines
Yeah.
and start a
That's
practice.
not quite costly. It's very costly.
Very costly. So
Yeah.
either you have to get yourself attached to a government institute or to a corporate hospital,
Yeah.
which is a drawback again. But there is another option. Those who are doing freelancing, you can establish your practice outside. You can take your cases to the corporate hospital, treat the cases there, and you can get paid for the case basis. And you can come out. Not necessarily you have to be attached with them, sit in the hospital, getting paid by them is another aspect. Having your own cases, getting established down the line for 5 years, you have to get yourself established. Then you can draw patients towards yourself. Take the patient and then you can treat them. Get paid only for the case basis. So that is one kind of private practice you can do. Or else you can go directly, get attached to the corporate, get paid for a fixed pay or freelancing, and then work there. So this is one drawback that if you want to do a freelancing private practice, it will take some amount of years, like basically your 5 years to get the reference for you. But other than that, yes, all radiation oncologists have the liberty to practice medical oncology as well for the solid tumors, which is legal in India because we appear a paper for medical oncology. We give exam regarding the chemotherapy. So not hematological malignancy we cannot practice. But for solid malignancy, concurrent chemotherapy, every radiation oncologist is legally authorized to practice. So in that way, you can practice both radiation as well as concurrent chemotherapy practice. Yes, like any other profession, you will have a struggle initially.
Yeah.
You have to go to places, apply your resume, find job, or initially you will start developing the contacts among your circle. Basically, the OGCS, ENT, head and neck malignancy from ENT, you will get cases from the obstetricians and gynecologists, and you will get from general surgeons breast cases, colon, rectum malignancy. So it's basically initially it's not bread and butter, cannot be fetched
So
just
that is
like
for every profession, ma'am, I think.
it
Yeah,
is for any medical profession. Basically,
any
now
profession.
we know that the competition is so high, the
Yeah, yeah.
outcome and the medicals are every
Every
year
profession.
increasing.
That's
Yes.
true.
So in any city, stick to the particular city. Don't keep roaming and punching for the job in every other
Mm.
city. Fix the city, get yourself established over a period of 5 years. Keep a cutoff of 3 years to 5 years, during which you will get yourself established. Develop more contacts, attend all the CMEs or meetings, then develop your link for your case referral and do an ethical practice. Then in meantime, after 5 years, yes, the graph goes up. Initially, you will get 1 or 2 cases over a month, over a week. Then it becomes every day you get one case. So it's that kind of a graph. That is how I established myself and I developed. After 1 or 2 years, I got the government job. So with the backdrop of government and in my private hospital, I started contacts and establishing. Then you start getting referrals, and that is how your practice graph goes up. Then after that, even if you say no, the case won't stop. They will keep trusting you. The doctors will refer you. You go, you show good results. You do an ethical practice. Then there goes your graph, and you, that is how I am now practicing in where I am.
That's good, man. And finally, one thing regarding the opportunities in outside India, like in because the radiation oncology is actually I can say it's upcoming field. So even now, even the corporate many corporate hospitals now only starting to build their oncology unit. So what about the opportunities abroad as per your knowledge?
Opportunities are wide because oncology is one of the top, like not in India. India, we choose radiation oncology as the last ranked people or those who didn't get the PGP or left out seats are taken. But in abroad, it is one of the top chosen field after cardiothoracic surgery,
Hmm.
after neurosurgery. It's one of the top chosen field because oncology load and the amount of insurance claims through the medical claims are too huge. So they prefer oncology there. And even anybody who's completing oncology courses here, they can they have a wide scope outside, both in UAE countries. They are more wanted in Canada. They are wanted in US, but US the terms are different. You go there, you have to course over there, and then only you get start practicing after again spending another 3 years in US. But in Canada, all you can go do a fellowship, then you can clear some baseline examinations. You can just settle down there. UAE is just like a basic exam interview. You clear that, you can go and well settle down there, and you are paid more and equal to any other top courses. The
Yeah, that's only
job
I supposed to ask. Like after post graduation, what is the pay scale? It is on par with radiology or any other post graduation, or it is higher than that? Or can you comment? Few comment. I mean, comment on that.
I will say it is in par with the other thing, but
Yeah,
definitely above any other master degree like general physician or any
yeah,
pediatrician because they get time to settle down and they need a seniority and the trust of the patient to just go and on their own. But this is not like that. Oncology, even your registrar, they start getting paid from 80,000. After
mm,
post MD, average in all tier 2 cities, they get paid with some 80,000 as the base pay for registrar post. After registrar, you become a junior consultant, you get paid like 1 to 1.3. Any
mm,
senior consultant after 3 years of junior consultancy, they get paid close to 2 lakhs per month. If it is a corporate hospital, I mean
yeah,
a corporate hospital. Even in all the aims established around India and Tata Memorial Hospital, they are paying give a basic pay of 1.3 starting salary per se for a
mm,
senior resident. And
mm,
consultancy just goes high above. Any
yeah,
senior consultants in tier 1 cities are getting paid close to 5 plus
mm,
senior consultants are getting paid. But I would say rather going as an pay scale of 80,000 as a registrar, to start sitting and
oh,
developing
yeah,
your own practice.
yeah,
So,
that's better.
in
Freelancing.
Tamil Nadu with the CM scheme insurance, you will be paid close to 10,000 per case by a corporate hospital. Even if you treat a case in a CM scheme, purely
Mm,
CM scheme, and patient pays nothing out of the pocket, the corporate hospital will pay you 10,000 as your fee from the part of CM scheme fund.
mm,
So imagine for one case you can earn 10,000.
mm,
So apart from that, you are doing a practice, OP fees, your medical fees, your chemotherapy,
mm.
easily you can earn that money. Uh, I think people should start their own practice rather than
Yeah,
stop.
this is always better now, and it's very nice to hear from you, ma'am. Like you have given a lot of information and it will be very useful for many people because so many for many, including me, till now the knowledge about this field I can say is zero. So definitely, I think the it will be very helpful for those who are in dilemma whether to take radiation oncology or not. So very thank you so much. Thank you
Thank
so much.
you. Thank you, Vinod, for the opportunity. It's my pleasure sharing this idea because I think this will send out a good information for the
Yeah.
future
I
medicos
think
which
we will, yeah, we will do more videos, man. I think this more content can need to be created on this aspect also. So we'll once again we'll make and we'll meet and make one more video. Be
sure.
better.